Good morning, and I'd like to welcome everybody to our community update. I'm going to start today with our enforcement update from December the 10th to the 16th from all of our enforcement partners. 7 tickets total have been issued, 4 by the Region of Waterloo Public Health. All were $880 tickets for failing to obey an order. Piper Arms Pub in Kitchener, there were no face coverings were required. Lack of distancing and exceeding the capacity limit. So face coverings were required and weren't being worn. Chicago Pub and Billiards in Kitchener, no face coverings when required. Pizza and Pub in Cambridge, patrons were not seated, no face coverings where required, and alcohol service beyond the prescribed time. And Town Line Barbershop in Cambridge, customer logs, disinfection, and a lack of distancing. 1 ticket was issued by Grand River Transit Security at Ainslie Terminal for failure to wear a mask. That's a $240 fine. 1 by the City of Kitchener bylaw, an $880 ticket for failing to obey an order. This was the East African Cafe. There were no customer logs and exceeding capacity limit. 1 by the City of Waterloo bylaw, $880 ticket for failing to obey an order. A private residence exceeding gathering limits. In addition to the COVID-19 update from our medical officer of health, Dr. Hsiu-Li Wang, we have added Deputy Chief Shirley Hilton to our weekly panel. Deputy Hilton is leading the Waterloo Region COVID-19 Vaccination Distribution Task Force. She will provide an update each week going forward as we roll out effective, efficient, and equitable delivery of the region's immunization program, starting with our high-risk populations as determined by the federal government. As the statutory holidays land on Fridays this year, we will be moving our weekly community update to Tuesday, December the 22nd next week and Tuesday, December 29th the following week. Until then, I'd like to remind everyone to keep your holiday festivities small and limited to the people in your household. And please continue to be creative and looking for ways to support small and local businesses. And please only go out for essential trips and follow public health protocols. Thank you. And now over to you, Dr. Wang.
Thank you, Chair Redman. So I'll start with overall trends. So we have now been under red zone restrictions for 3.5 weeks. Case rates in Waterloo Region remain high, and we are at risk for further increases. Our incidence rate, approximately 85 cases per 100,000 per week, is similar to our rate 2 weeks ago. Ontario's rate is 100 cases per 100,000 per week. We are currently 8th in Ontario. Our current percent positivity, taking into account interim data, has not changed very much recently and is currently 3.4%. Our reproductive rate has also remained relatively stable, recently between 0.8 and 1.1. We are, however, seeing an increasing number of care homes going into outbreak. And we currently have 2 larger outbreaks in long-term care and retirement homes, where there are a high number of residents and staff who have tested positive for COVID-19. As I mentioned Wednesday, we continue to see more hospitalizations and ICU admissions and deaths. Large outbreaks in care homes also require greater supports from hospitals and other healthcare system partners. Our healthcare system, like several others in Ontario right now, is under very heavy strain, and the situation is not sustainable on an ongoing basis. Some dashboard updates. So we have made changes. We have made some updates to our methods for mapping cases by neighborhood that you will see in this afternoon's dashboard update. So the update to our methodology has improved the accuracy of assigning cases to neighborhoods. So previously we had used postal codes to map cases to specific areas, One of the limitations with that method was that in rural communities, postal codes cover large areas and can cover more than one neighborhood. We are now using full addresses to match cases to neighborhoods, which is more accurate. So later this afternoon, you will see a change in our map data with the most notable changes in rural neighborhoods, in particular the villages of St. Jacobs, Wellesley Village, and Ayr. Our previous method did not have any cases assigned to them, so they appeared white or non-reportable on the map. A few urban areas were also affected, but because they already had higher numbers, the effects are less visibly noticeable. The new method also reduces the number of cases for which we are unable to map because of invalid or missing postal codes. So previously 3.8% were unable to be mapped. That number has been reduced to 0.5%. I also wanted to provide an update on the order across certain Mennonite communities. So on December 2nd, due to the uncontrolled spread, I issued Section 22 orders across certain Mennonite communities in Waterloo Region and to their affiliated parochial schools and places of worship. Since that time, the communities have diligently been working with us to implement public health measures in both their parochial schools and places of worship. That would enable us, to lift the Section 22 orders and for them to be able to operate as other schools and places of worship in the region would be able to. So as we receive written affirmation that the required measures have been implemented for each parochial school or place of worship, I am and will be rescinding applicable Section 22 or the Section 22 order for them. As such, given the work that has happened over the last few weeks, we anticipate that should the province permit places of worship and schools in general to be opened, some churches will start reopening this Sunday and some parochial schools will start reopening next week in keeping with the rest of our community. So I want to thank community leaders and members, as well as our partner agencies who have worked, and our public health staff who have worked together to slow the spread of COVID-19 in these communities. In closing, our situation is serious, and the second wave is a significant threat to our community. I am asking our residents to drastically reduce social interactions. I recognize that may present hardships and many may be feeling isolated. Your mental health is important. If you or someone you know needs help, local mental health support is available at 1-844-437-3247 or visit here247.ca, the word here247.ca, and it will be on our website as well. While we must stay apart during the holiday season, we can connect and support each other in spite of the distance. There are challenges ahead of us, but there is hope too. Waterloo Region is a caring and resilient community, and we will get through this together. Thank you.
Thank you very much, Dr. Wang. And over to Deputy Chief Hilton's update.
Good morning, and thank you. The Vaccine Distribution Task Force continues to meet daily to discuss logistics and will continue to take our lead from the provincial task force. Members of the planning teams have begun to reach out to local long-term care homes to start preparing for the immunization process. The province is expected to release the list of provincial clinics today, and until then, we cannot disclose the location of any local clinics. However, we anticipate our first shipment of the COVID-19 vaccine to be received as early as December 23rd. If we receive the vaccine in a timely manner, we will be able to administer doses on that day. And if not, we will begin vaccinating on December 24th. We want to stress the fact that the first doses will be given to staff at long-term care facilities and hospitals. These will be done by appointment only. We encourage members of the public to not call local pharmacies or their doctors to book an appointment for the vaccine. Vaccines will only be administered at one verified clinic, and at this point are by appointment only. The vaccine is not anticipated to be available to members of the general public until possibly late 2021, mid to late 2021. It's too early for us to know that specifically. And although a vaccine is an important step towards recovery, safe distribution to the general public will take time. Along with your patients, we ask that the community continue to follow the public health guidelines, and we ask the public to remain patient as we work hard to vaccinate as many people as quickly as possible. Thank you.
Thank you, Deputy Chief. I'll now go to the media for questions. Damon, do you have a question?
Yep. So for Dr. Wang, are you surprised at how fast you were able, public health was able to turn around the Mennonite situation?
Yeah, I would really characterize it as the Mennonite communities working with us that had really enabled this, right? Really very grateful to their leadership and many community members who have been working with us. So it's as well as the healthcare partners who have been working really hard and continue to do so to support the Mennonite communities. And so yes, so we're happy to see that the spread has slowed, and that they are very diligently working with us to make sure that all the requirements in their parochial schools and in their places of worship are also there for us to be able to start to lift the orders. So yes, it's because of their efforts and the efforts of our healthcare partners as well. Thank you.
Damon, do you have a supplemental?
Yep. So for churches and the parochial schools, how will public health work with the Mennonite community to ensure there is no COVID fatigue and that things aren't just being followed until they can be ignored?
Yes, well, they will need to implement all the required measures for schools and places of worship in general, right? And it will be in keeping with the rest of the community in terms of what they need to put in place, and they are planning to do that. And we're working very closely with them, with individual school by school, and we also have our team of public health inspectors that's gone out to some of the schools already, and places of worship, and will continue to go out and visit with them, and we'll be supporting them also in this hands-on way to ensure that their various settings meet the requirements for schools and places of worship in general, and can reopen. So once we have reviewed what they've done, and we feel the environment has all the requirements in place, then the orders are lifted for the individual places of worship and schools as we get that information in.
Okay, Kate, do you have a question?
Yes, I wanted to start off with some comments you made when you were speaking to council the other night, Dr. Wang. You were talking about the possibility of a lockdown and that you were going to talk to Dr. Williams before today. I'm wondering if you able to have that conversation with Dr. Williams and whether you've advocated for us to go to lockdown on Monday?
Yeah, what I've done is kept Dr. Williams and his team informed about the situation in Waterloo region, which is what I talked about on Wednesday and this morning, right? The state of our region and the fragility of our healthcare system right now because of our high rate of spread of COVID-19, like other red zones and lockdown zones, where the spread continues to be high. There are discussions right now at a provincial level that may involve more than just Waterloo region. So, I can't speculate as to what those may involve, but my role was to make sure that Dr. Williams understood, the situation on the ground here in Waterloo region to be able to make the best decision for our region as well as potentially for other regions as well. So I really advocated exactly what I talked about on Wednesday and this morning, which is that, we have high rates, they're unstable, and our healthcare system is under a very heavy burden, and that this is not a sustainable situation for very long.
Kate, do you have a supplemental?
I just wanted to clarify. So would you tell Dr. Williams, like, I think we should go into lockdown, or is that something that you just provide the information and then they make the decision? Like, you would never say, put us in lockdown, please.
No, that, I can make recommendations. I think there aren't specific criteria for lockdown, right? That's a bit of the difference between lockdown and other colors. So had it been there were specific criteria and we had passed those, and I could say, we've passed those criteria, so according to your framework, we should be, in this new category. This is not the case. And it's a more qualitative assessment that's being done at the provincial level for us as well as other regions. And so given the increasing pressures on our healthcare system, I have, as I mentioned on Wednesday, I am advocating that there needs to be stronger measures in place to be able to start to slow the spread and to reverse the trends, right? Because Ontario is on this path of continual growth, as we've seen in the Ontario numbers. 1% to 2% growth, I think, is what they said late yesterday. That's just going to increase the pressures on our healthcare system in multiple places, including here, where we're already strained. And so, something stronger needs to be done, and potentially at a broader level as well. And so, what I did tell Dr. Williams is that, more needs to be done.
And Kate, just sort of as a footnote, one of the things that Regional Council, as municipal leaders, as well as the Board of Health, have indicated publicly is Dr. Wang has our full support in taking that message forward, which I think is really important. Tim, do you have a question?
Yes, I do. Dr. Wang, Wellington Dufferin Guelph Public Health has said that they won't require students in that area to be immunized to stay in school. I was just wondering about students here. Will or won't they be required to be immunized to stay in school in this region?
So that's a provincial decision, but I can tell you that in Ontario, there isn't any vaccine that's been mandated for any student. There is this the Immunization of School Pupils Act, or sometimes abbreviated ISPA, which we enforce every year in public health, and that's the records of the students. So the parents have to give us their records of immunization, but parents have always been able to through declarations that they make with a commissioner of oaths, to say that, they're consciously objected to immunizations and therefore be exempted from the Immunization of School Pupils Act, or parents of children may, inform us that they have medical contraindications as determined by their medical practitioner. So there's always been these exemptions possible in those circumstances. So it's not been mandated for students 100%. So that's the way it's always been in Ontario. And I don't expect that it would be different for COVID vaccine. It will remain a provincial decision. So,
Kim, do you have a supplemental?
Yeah, I was just wondering about the announcement that was made by the Ontario government in long-term care, the $1.9 billion and 27,000 new jobs. Just wondering if that's sufficient, and do you believe there should be more funding in long-term care, especially as we continue to get through this pandemic?
well, that's a good question. I think that the long-term care associations and the homes themselves may best be able to answer that, because like funding announced for other sectors, they know best, what that could mean for their sector and how it compares to what they feel they need. I would just say it's great that we're seeing more supports, but for supports to be able to be put in place, it always takes time, right? Right now, there are human health resource. There's not enough human health resources across healthcare systems in Ontario, period, especially in long-term care homes. That's a fact. That's why when homes go into outbreak, even if it's a small outbreak, they can be destabilized because of staffing challenges. And so that's why health system partners locally try to do whatever they can across different sectors to try to support these homes. But that's a long-standing issue. And so I don't think, reinforcements can happen overnight. But I'm glad that there's a plan for increasing funding and supports to long-term care homes at a provincial level. I think we all recognize it's greatly needed. So I'm glad there's additional things to be done, additional things that will be done. As to whether that's enough, I think the homes will be best placed to answer that. Thanks.
Joanna, do you have a question?
Yes, thank you. Dr. Wang, you talked about the current situation being unsustainable. Given that Christmas is now a week away, what are your concerns then about 2 weeks from now, when there's likely going to be a lot more cases?
Yeah, that's a good question, Joanna. So that's why I'm concerned, because even though, our hospitals are working extremely hard and our healthcare partners overall are working extremely hard to, just continue to deliver as much service as possible, although sometimes they'll have to prioritize that now already. Hospitalizations, ICU admissions, deaths, they're all lagging indicators, and the trend that Ontario is on is an increasing one for hospitalizations and overall across hospitals in Ontario, and our hospitals are no different. So that is very worrisome. That is why it's really, really important for our community to understand that we need to do everything we can right now to drastically limit social interactions, because, we can't have another spike in infections after the holidays. That will put even more pressure on our healthcare system. They're already at very high levels of pressure. That will likely increase in the next couple of weeks, just because we're already on that trajectory. So we need all our community to get behind the healthcare system and our healthcare workers, and not gather over the holidays so as to not create even more pressure on the healthcare system, which will not be sustainable.
Joanna, do you have a supplemental?
Yeah, and I'm not sure if it's for you or for Dr. Wang, but you, Chair Redman, you gave an update on enforcement. And Dr. Wang has repeatedly asked the community to limit their social interactions. Is it enough to do these enforcements in restaurants and I guess for large gatherings in private residences if you can't really control what people are doing sort of on their own and when they're interacting with people, but that seems to be where the spread is happening. So I guess like what can be done? Like you keep asking people not to gather and socialize, but it is apparently continuing to happen.
So I'll go first and then Dr. Wang can do the hard part. I would have to tell you that we've been given this color code in these different zones that we're in by the province. All except lockdown come with certain restrictions. Even lockdown comes, I mean, there's no indoor dining. People can't go into retail stores. It's all curbside pickup. So being in red, it is up to the four, all the area bylaw officers, regional bylaw officers, and public health inspectors, as well as Waterloo Regional Police, to make sure that people are adhering to those rules. Those rules are directives sent out by the province, and we're trying to operate and allow people who are adhering to those guidelines to continue to operate. So what we have is a tool of enforcement if people aren't. So it's one of the reasons why Dr. Wang has issued some Section 22 orders, specifically when it looked at hotspots, or one of them was the certain members of the Mennonite community. Some of them were the big box stores saying that you have to adhere to these protocols and guidelines by public health. That's really the tool that we have right now, as well as relying on the participation and the willing partnership of people in the community and businesses in the community to adhere to the public health guidelines. Dr. Wang?
Yeah, no, thank you, Chair Redman. So what I'll add is we have been, as you can see, Joanna, been trying to minimize restrictions, minimize closures, and have people do things of their own accord. But if that's not enough, and it looks like it's not enough, then we need stronger measures. And that's why the next step after red is lockdown. And I understand from press reports there's consideration of additional measures as well. That's what will need to happen then. Broad-based measures that are no longer voluntary. So that's unfortunate. But if we have to go there to ensure that our healthcare system can care for anyone that has a need and is not overwhelmed, then that's unfortunately not what we'll have to do.
Mr. Lochner is on this update as well. Mr. Lochner, do you want to make any comments on this aspect of Joanna's question?
Sorry, someone just popped in and I got distracted. Can you repeat it again?
It was basically saying I gave the enforcement update, and is that sufficient right now? And what Dr. Wang and I have said is because we're in red, we're trying to make sure that everybody is adhering to the guidelines, the laws, and the rules the province have dictated. But having said that, it really is prevailing on people to behave and comply, and businesses to behave and comply with public health guidelines.
Yeah, I think that's...
And if we don't, we have to implement broad-based measures that are no longer voluntary.
Yeah, I would concur with Dr. Wang. I mean, people are tired. We've talked about this before. People are exhausted, but the reality is our hospitals are in trouble. Our health system's in trouble. And unless we turn this around through more compliance and less social spread and people staying home, I think government will be forced to take more significant measures to save the health system and ensure the capacity is there for those who really need it as they get sick. So it's unfortunate. That's where we're at.
So Nicole, over to you. Do you have a question?
This is a follow-up in regards to some of the comments you said on Wednesday to council. Both you and Ms. Fairclough said we are at the tipping point when it comes to the healthcare system. But looking at the numbers, you know, the numbers seemed less back in the fall, and we were concerned, and we were at the tipping point then. Would you say then that we've already tipped over?
You know, that's really one for the hospitals to answer, because, you know, they have contingency and surge plans, and they also work across hospitals to try to, you know, ensure that resources could be redeployed if needed across an area, as opposed to just relying on every hospital to be able to do everything all the time. So, you know, they're helping each other out. So it's a very fluid situation, but overall, it's gotten to a level where, as Ms. Fairclough said, they are at a tipping point. It's very fragile. The system pressures are very high right now. And the projections that the province have put out in terms of hospital admissions and ICU admissions is that they're going to continue to climb. So that's why, you know, there was a letter from the CEO of Ontario Health to hospitals in Ontario, or actually in particular to hospitals in red and gray zones, to prepare for that increase and to, you know, put in additional contingency measures for that. And that, you know, has led to some procedures that had to be postponed again for other people who need care for other reasons. So it's a very fragile situation. You know, our hospitals have been doing a tremendous job to try to manage that to the point, you know, to the extent possible, but at some point it will not become manageable. And so that is, you know, that is why, you know, stronger action is needed. And this is not an issue that only affects Waterloo Region. So, you know, that's why stronger measures are likely needed over a broader geography as well, just because of what we're seeing now in terms of the health system pressures.
My next question is for Deputy Chief Hilton. The province just announced that Grand River Hospital is the chosen location, and that 90,000 vaccines will be deployed to the 17 locations across the province. Are you able to say how many are earmarked for Waterloo Region? And given that Wellington, Dufferin, Guelph is close by and they don't have a location, can healthcare workers from those areas then come and get the vaccine here in Waterloo Region? Will they be qualified to do so?
Chief Deputy?
Thanks, Nicole. You stole my thunder. The information was coming out as the briefing was ongoing, and I was sitting on pins and needles to ask if I could release the information. And so thanks, Nicole. So yes, indeed, Grand River has been selected as one of the 17 sites to deliver the initial phase of the COVID-19 vaccine. I can't speak to the exact amount we might be receiving at this time, and I will actually turn it over to Dr. Wang to discuss the various public health.
Yeah, Nicole, I would refer you to the ministry and or to Wellington, Dufferin, Guelph, because you know, the ministry have confirmed that doses that our region would receive would be for our region. So, but there, you know, are going to be provisions for other regions as well. So.
And if I could just add to that, Nicole, I think we have to remember too that the vaccines are, as Dr. Wang had said, for our region, it'll be by appointment only. So this first shipment of vaccinations will be spoken for as it relates to those that through our priority population within the region. So if that helps a little bit.
Okay, I'm guessing that might create more questions. Anybody else have another question? Kate, go ahead.
The question I have is actually not about the vaccine rollout, but it is for Dr. Wang. This week, we've posted a few stories to our Facebook page and talking about increasing cases and, you know, your comments to council the other day. And a lot of comments are, well, of course, cases are going up because school is in. And I'm wondering if you could address whether or not we're seeing an increase or a rise in cases because students are in school. You know, a lot of people are saying, well, cases started going up in September, and what else happened in September? Kids went back to school. And I would just like to get your take on that.
Sure, no, I understand. It's an understandable question. You know, what we've seen is the numbers in our schools, similar to the numbers in our long-term care homes, they follow generally the level of community spread. So, you know, we have had more cases detected in students and teachers, you know, as our community spread has gone up in Waterloo region. That was expected. We also have, from time to time, some outbreaks that occur in schools, but those are relatively infrequent, and the outbreaks are controlled because of the measures that have been put in place, the multiple measures and the efforts of the schools, the teachers, the parents, you know, because of all their efforts as well. So in terms of spread in schools, it's really been much less. What we've seen.
Shirley, you're freezing.
You know, through September, right? The most frequent areas. I'm sorry, is it better now? What we've seen through, what we've seen through September, October, November, and now in December is most of the spread is occurring either in social gatherings or socialization among workers in workplace settings. You know, when they're in employee-only areas, and I don't mean socialization as not as you know, they're off work. It's you know, when they're on lunch, when they're on break, and they have an opportunity to socialize, so to speak. They, you know, that's when the spread is happening. And so we've seen really predominance to date of community spread and spread in workplaces. And now, you know, we're starting to see more cases in schools, which have risen as a function of the cases in the community, and cases as well as outbreaks in long-term care homes has also now more recently gone up. And so, you know, overall, so what we see overall is, I would say there's two things. You know, because of all the measures and the efforts of the school communities, it's not, you know, the spread in the schools hasn't been a significant issue, but as you may remember, I have been mentioning, if you reach high levels of community transmission, you're going to increase the chances that it could become an issue in settings that have more controlled measures, like schools. You know, you can't prevent everything, even if you have measures. When there's high rates of community transmission, there's a greater likelihood of cases and potentially spread. And so that's why the important thing right now is to focus on the overall reduction in interactions in our community to lower the community spread so that it can also be safer for schools.
Joanna, you had another question, and then we'll go to Nicole. Go ahead, Joanna.
Yes, for Deputy Chief Hilton. You mentioned that the first doses will be by appointment only. Will there be like a clinic set up at Grand River for these first people to get the vaccine? And also, is there a plan yet for how it will be administered to the general population when we get to that point?
Thank you for the question. Yes, as Grand River has been selected as the site, there will be a clinic set up at that location. Right now, the efforts have been put toward immediately setting up clinics for the first dose coming in rather. However, there is planning already in place to facilitate other doses and potentially other clinics, but that's down the road depending on when Moderna vaccine is available. So that planning is in place currently, but that is into the future. When I say into the future, the province has already looked at a 3-phased process, and that's what we're following as well.
Okay, Nicole?
This question is for Dr. Wang. Can you address staffing concerns, not just at hospitals, but the testing sites, public health case contact tracers? Like, is there an overall staffing concern with the amount of cases that we're dealing with? Nurses having to be off because they have COVID. Is that, I guess, the main pressure point that you're feeling within Waterloo Region? Because we have infrastructure, right? But it's just the people are also resources.
Yeah, there for sure. That is a very significant issue across Ontario and across the healthcare sector, and we're no different. Increased cases put additional strain on multiple health system partners like hospitals, like labs, like community agencies who have healthcare workers, but then need to support, for example, homes that are in outbreak and desperately need staff, and public health units as well. So it is a broader health care system issue. There's been lots of planning done and implemented by all these partners to upstaff, and we're continuing to do that. But you can just imagine, if numbers double or triple in 2 weeks, you can't double or triple the number of doctors and nurses that are highly skilled and trained to be able to do the required interventions in 2 or 3 weeks. It's not possible to keep up if there are high rates of spread and it just keeps climbing. That's why, I think there's been tremendous efforts made by our healthcare partners to be prepared. And also, as mentioned previously, efforts to really not put in more restrictions than we have to. But, if we're not able to have enough people following the requirements and reducing the spread with the measures that are in place and that have been progressively tightened as our rates have gone up, then we need to continue to do more. That unfortunately is going to be difficult for other reasons for our community. But if we don't tighten up measures, when we've reached a point where our health system capacity is at risk for not being able to deliver services for those most in need, COVID or not COVID, then strong, broad measures will need to be implemented.
Okay, thank you. Anybody with a last burning question? Damon or Tim, do either of you have another question? Oh, Kate and Joanna. Okay, back to Kate and then Joanna.
Mine is more just a request, and I don't know if this is for Deputy Chief Hilton or more Julie, but next Wednesday or Thursday, when those first shots are administered, I think I can maybe speak for other media that we would very much like an opportunity to take photos and maybe even speak to the first person that gets it. So just throwing that out there, that would be lovely.
Deputy Hilton, do you want to comment on that or just take it under advisement?
No, and we anticipated this, obviously. So our communications team will be in contact with media around that first clinic. So stay tuned.
Joanna, did you have another question?
Yeah, a question for Dr. Wang. Would you support moving students to online learning for, say, 2 weeks after the Christmas holiday, just to ensure that they're not going back to school after seeing all their family and potentially bringing the virus into the school?
Well, that's a good question. I think that would need to be taken into context of what will the province do overall for all settings. Schools are a setting that we need to consider. Right now, schools haven't had the same level of spread as other settings, but we're closely monitoring, and as we know with COVID, things can change. But right now, they haven't had as much spread as other settings, and so what we do with schools can't be an isolated decision. That needs to be, they need to be considered as part of the broader decision of what we do with settings overall, businesses, all businesses overall, and I know that those discussions are currently taking place at the provincial level, and depending on what happens and what's announced for our region, obviously I will be assessing to see whether I think that's proportionate to what we're seeing here or not. Yeah.
Okay, last call, no more questions. Joanna, one last one.
Sorry, can I ask a question for a colleague?
Yes.
Okay. So the new mapping shows that rural North Woolwich had a high non-outbreak infection rate in the first wave.
Yeah.
And now we're seeing that again, but during the first wave, we weren't aware of that. If that had been known, do you think perhaps what's going on in some Mennonite communities now wouldn't have been so severe?
Yeah, I think there's some information that provides some more context to that. I think there may be an assumption that the cases were Mennonite cases, and that may not be the correct assumption. So I think I understand that question has come into multiple people and to us as well. So we're going to be working on a response for that. So I think it's probably a bit more complex in terms of the answer, and I'm not able to speak with my team either at this time. So we will get back to you on that on that question. That's okay.
Well, thank you all very much. And just a reminder that the next community update will be Tuesday, December the 22nd. Everybody stay well and stay tuned. This is a quickly evolving situation, and we'll talk to you on Tuesday.
Okay. Thank you.